Hi, folks. This is Dr. Rob CYWES. I am the carb addiction doc. And I've been traveling recently doing talks across the country, and it's been very cool to visit with folks and see how many folks out there, how many young couples having children, raising young children, thinking about getting pregnant, are moving their children's diet more and more toward a ketogenic, even possibly a carnivore family. I recently met Dr. Ruben Bolaños in San Diego. He's a physician who was actually a young guy, was going to be an ophthalmologist, and he just felt so passionate about his own keto journey that he opened up a ketogenic practice. And he's seeing patients very similar to myself in Mexico. So if you're Mexican, if you are interested in working with someone doing a lot of what we're doing, he's a great guy to hit up. But what's cool is he showed me videos of his young son, and that child has been keto carnivore since he was born. And you can see this kid sucking away on a ribeye steak or chowing down on a kid's less than a year old. And this is what he's doing for his health. And then I saw a video of a friend of mine, Judy Cho. Judy's got a 6-year-old chowing down on a hamburger with some cheese, nothing else there, just chowing down on a carnivore meal by choice. My buddy Ken Berry, most of you know Ken. I mean, he's just a brilliant, brilliant man. And he and Nisha now have 2 kids, both of them on a keto carnivore diet. So more and more, we are doing this. If you want to find out what my son eats, my wife is Carb Addiction Mom on YouTube and on Instagram and Facebook. Follow her, check out what we eat. She posts photographs of what we eat. And it's kind of funny. My son's just turned 2, and the other day we were eating, and it was food from outside. It was mostly meat, but there was a little bit of lettuce. And the little kid's sitting there picking out every piece of green and putting it on the side and saying, "Mom, I don't eat that." It was just hilarious because every other kid's completely the opposite. So why are we doing this? Why are we doing this? And my son has been pretty much a carnivore, about a 95% carnivore since before he was created, since he was just a sperm and an ovum. So we both put ourselves on this trajectory way back, and my wife and I ate this way knowing that we were planning on and trying to have a baby. So he was created into this environment, was born into this environment, lived in utero in this environment, had a little bit of an upset because we couldn't breastfeed him. We had to formula feed him, and we imported specific breast formula, Leluca, which in fact Ruben gave to his son as well, from Europe. Because of the altered content, we use ketogenic formula. And at 4 months of age, he sucked back on his first piece of real food, which was a piece of ribeye. And a couple of interesting things. Number one, we have never, ever warmed his milk. From when he was born, he just had room temperature milk, which was kind of interesting. Apart from the breast milk that he was able to have for a little while until Janae was no longer able to breastfeed, he pretty much has had warm temperature milk, whatever that may mean. Secondly, at 4 months of age, because he was a term baby, we introduced him to real food. First thing was a ribeye steak that he sucked on, a big chunk. And as long as you monitor them, they're not going to choke. They know what to do. This is what we've eaten for eons as a species. That he was gumming that steak and chewing it and sucking it dry. And our entire life with him, he's just turned 2. We have never, ever, ever spent a penny on baby food. You know how much money we've saved? Not only have we saved a ton of money, he basically eats what we eat. He eats off our plate. He eats our food. So as a family, we eat the same food. You know how much money we've saved? We'll talk about the health benefits in a little bit. But the other part is on the back end, and here's a kind of a bizarre thing. You know that breast milk doesn't contain any fiber. It was us humans that said, aha, you know what? God and nature, you guys are wrong. We have to put some fiber into formula because formula has fiber in it. But breast milk doesn't have fiber in it, and the Leluca that we used didn't have fiber in it. So, and yet, my son didn't explode of constipation. He pooped completely normally. But for the last 2 years, while he's been in diapers and pull-ups, eating carnivore, you poop a hell of a lot less. We've saved a ton of money on diapers. He doesn't poop that much. When he does poop, believe me, it comes out. And I know this may be a bit gross for some of you, but he poops less. Formula-fed babies, crack-fed babies, and I call sugar and starch crystal meth. I mean, it is horrible what they're feeding some of these children, what most people are feeding their kids, without knowledge. But the amount of poop you create when you're feeding your baby all these Gerber slop is enormous. So we have a reduced expenditure on diapers. We've only been to see the doctor because of shots. Very, very healthy young man. Growing like crazy, beautiful jawline. We're going to save a ton of money on orthodontics and braces and that kind of thing because his teeth are perfectly straight. And I can tell you mine are not, so it's not genetic. But yeah, his jawline is strong. If you look at this part of the jawline, you can see mine slopes up. Janae's is better than mine, but he's got this level jawline. Just a spectacular thing. Not because of his genetics, but because of how we're raising him. And his brain is fantastic in terms of development. Again, not because of genetics, but because his brain is getting the best substrate it can get. If you think about the Three Little Pigs story, if you build your house of sticks, if you build your house of twigs or straw, it ain't so good, it ain't so sturdy, it doesn't work so good. But if you build your house of bricks and mortar, that thing stands forever. You can't blow it down. And that's what we're doing with his brain, giving him fat and protein. And his liver is making a little bit of glucose, but he's in ketosis all the time. All the time. And that is so good for a baby's brain. We don't want him to have autism. We don't want him to have ADHD. We want him to maximize his genetic potential by giving him bricks and mortar to build his brain with. And true for his body as well. This little bugger has muscles on top of muscles. I mean, his muscles are doing push-ups on top of each other. He's got so much muscle. He's not any more active than any other kid, although he's perseverant and he runs around like crazy. But he has muscular growth. Why? Because he's getting the food that his muscles need to grow. He has calf muscles like rocks in the back of his legs. I don't. Janae's got good legs, but not like he has. And that's because of his food. He's running around and playing all the time. So it's so important, to my mind, that you give your kids the best shot at life by preparing them, give them the building blocks that they need. And this is the thing, you're not depriving them of sugar and starch. You're not depriving them of a cigarette or shot of whiskey. In fact, what you're depriving them of, folks, is a little bit of obesity, a little bit of anxiety and depression, and a little bit of diabetes. And you're depriving them perhaps of a heart attack in their 40s, 50s, and 60s. No, you're not depriving them. You're preventing those diseases. You're reducing that risk. Now, down the road, it'll be his choice. But if we set that foundation and we set an effort-based self-care foundation for him, he's going to be the best he can be. Have that conversation with your spouses if you're young and you're about to have a child, or have a child. So much easier to start that way than try to convert them afterwards. If you're a grandparent or a loved one of someone who's thinking about having a baby or is pregnant right now, share this video with them. Talk to them, because it is not difficult to do. The savings are enormous. The dollar figures are enormous in terms of the savings. But you cannot put a price tag on a young human being who's probably going to live to close to 100 years. You cannot put a price tag on the best start at life for that child. So we have a carnivore kid. And then the only other thing, the other critical thing that is very, very important in his life, if it can be important, if it's not an allergy situation. Think about this, folks. What one substance do all mammals raise their kids on? And the reason for it is because there's everything in it that they need and a huge amount of growth formula in it. Growth factors in it. And that is milk. Breast milk is ideal, human breast milk, but cow's milk, raw, high-fat cow's milk is the ideal milk if you can source it, but milk of any kind is ideal. And then, so my son gets a bottle of whole milk with some heavy cream or raw milk, if we can access it, twice a day, once in the morning when he wakes up and once in the evening before he goes to bed. And I do add some DHA fish oil to his morning milk. We tried with the tablets. He liked the chews for a little while, doesn't like them now. So I have a dropper of fish oil. It doesn't go rancid. It doesn't go rancid. Throw that BS out the window. You can taste it yourself. The fish oil is fine. And he gets that every morning in his milk, and he loves his milk. He just pushes me away while he's drinking his milk. That stuff is going down. And it is growth for him. Right now, my son is 97th percentile for weight, 95th percentile for height, and is about as healthy as a young human being can be. Join the club. Join those of us, Ken Berry, Judy Cho, Ruben, and so many more. Throw your videos at me. Throw photographs of your kids at me. Throw pictures at me. I will post them if they are chowing down on a ketogenic animal-based diet, because that is what we want to promote against the vegan Gerber slop, the white food that all kids are raised on these days. The refined starches and sugars that are crippling us as a species. I am the Carb Addiction Doc. My wife is the Carb Addiction Mom. Check out our videos. Subscribe to this channel. Leave your comments down below. Leave your comments down below. This is an experiment. I'll let you know in 80 years' time what the experiment looks like. But we've bought into it, and it seems to be working really well. If you want a consultation, if you're struggling with a child with autism spectrum disorder, if you're struggling with a child with anorexia or obesity, give us a shout. We have a whole team that understands and can slowly help you to help that child or help your family. Give us a shout. Text, WhatsApp, 561-517-0642. I am the Carb Addiction Doc. I have a carnivore-raised family. But I'm also a pediatric surgeon. I am trained to work with children, and we have both mental health and dietary specialists in our office that can work with you from the mental health side as well as from the dietary side. Take care. Leave comments.